Hello, everybody. I'm Dr. Mark Morningstar. Welcome back to another edition of the Scoliosis World podcast. I'm actually going to be talking about today probably one of my most prized inventions, my signature invention, maybe, if you will, which is what we call the Scoliosis Activity Suit. But just some background on Scoliosis World podcast. The purpose of this podcast is to share with you information from the trenches. Doing a lot of deep dive on a lot of the underlying reasons as to why scoliosis occurs. Do a deep dive on all of the reasons as to why a small scoliosis curve becomes a large or severe scoliosis curve, and why there are a lot of things that have to be done in cases of scoliosis in order to best provide the physical treatment of the curve with the chance to succeed. So, within that context, welcome to Scoliosis World. As I mentioned, today I want to talk about the Scoliosis Activity Suit. So I figured for a lot of people who don't know, I kind of figure it would be best to kind of give you some historical context on the Activity Suit, when it was invented, how it was invented, how it came to be, and of course what we use it for present day. And I'll give you some of the data that's been published on it over the course of time. And we'll do a little bit of a deep dive on the Activity Suit today. So welcome to the Scoliosis World podcast. So starting out, the Scoliosis Activity Suit, just to give you an idea, a background, the Activity Suit is not a brace, okay? The Activity Suit is correctly identified as an exercise device. In fact, even the patents that I was fortunate enough to be awarded for it label it a core activity training suit for scoliosis. Nothing in there says brace at all. And the reason being is because it doesn't act like a brace. It works entirely differently from a brace. And so using it sometimes in conjunction with a brace is not necessarily a bad idea. They're not mutually exclusive. But for those of you who don't know what an activity suit looks like, I'll have the producer put a screenshot up of an activity suit, and we'll kind of break it down. Some of the components of the suit, how it works, why it works, what's the typical wear schedule somebody would use it for, and so on. But to give you background first, so back in 2006, I had the opportunity to present at a conference for a group called SOSORT, which I was a founding member of. And this particular conference was in Poznan, Poland. Well, the cool thing was during the conference, I had the ability to meet with some local physical therapists who were, of course, doing a lot of work with scoliosis. And one of the things that they were doing, which I thought was incredibly interesting at the time, is that they were using something called kinesiotaping to wrap around the torso. And they would start it literally down under the foot of one leg and wrap it around in a spiral fashion all the way up through to the torso and to the shoulder. And I was fascinated. And of course, I had been using up to that point kinesiotape for several years. In fact, I was the first chiropractor in my local area to ever get certified in kinesiotaping. At the time, it was all PTs, OTs, and athletic trainers. Even though, ironically, kinesiotape was invented by a Japanese chiropractor. But be that as it may, I came home and I instantly started playing with my kinesiotape for my scoliosis patients. Well, a couple of things quickly emerged. One is, of course, is that it's not necessarily easy for the parent or the child to replicate that tape every, say, 3 to 5 days at home. It becomes impractical. But secondly, one of the other good and bad things about the tape is that the adhesive on the kinesiotape is very, very strong. And it's designed to last. So when you put tape on somebody, it's going to last, 3 to 5 days, sometimes longer. However, when you keep repetitively reapplying the tape, what I ended up finding out is that in a great number of kids, their skin would start to react and kind of rash up in response to the adhesive on the tape. And of course, when that happens, you can't really use the tape anymore because now you're just going to get skin breakdown, and now you run risk of rashes and allergy responses to the glue, and it just became impractical. However, when in the process of using the tape, we were finding that it was working incredibly well. And so I had to think, how can I develop this same kind of spiral rotational pattern, but not use kinesio tape? And that's really where the Scoliosis Activity Suit was born. And so starting in 2007, 2008, started having prototypes produced. And we ended up coming up with a very asymmetrical, like obviously, as you saw in the picture, a very asymmetrical sort of a neoprene wrap. And in fact, when I first created it, I called it a tornado suit. Well, problem with that, of course, that I didn't realize at the time is that there is a motorcycle suit called a tornado suit, probably because it's a cool name. But I didn't want the stigma of calling it Scoliosis Activity Suit because I wanted primarily kids to use this particular exercise device. And I thought kids would think it was far cooler to wear a tornado suit versus wearing a Scoliosis Activity Suit. However, the name was taken, so I had to change it. So Scoliosis Activity Suit stuck. And so, of course, all these years later, it's still a Scoliosis Activity Suit. Now, some people might have heard to it because obviously for several years I was involved with the ScoliSmart group. And so you will still see and hear it referred to as a ScoliSmart Activity Suit, which is fine. They're the exact same thing. No worries. But the advantage of the suit is that even though I started out having a lot of kids wear the suit, well, the nice thing is the suit can replace a lot of day-to-day physical therapy for scoliosis in a way that's much more manageable on a longer-term basis. And the reason for that is, intuitively, we all know this, but we all undergo what I would call exercise fatigue or therapy fatigue. I mean, think about it. We all make, we're in December. We're going to be coming up here on our New Year's resolutions here in a few weeks. I mean, let's be honest. Everybody makes a New Year's resolution and it's already broken by, what? Do they make it even the month of January? You know what I mean? Everybody says, all right, I'm going to start hitting the gym this year. They might make it to the gym a half a dozen times at best, and then they just fall out. Why? Because our schedules are such that it becomes increasingly difficult to stay disciplined in that regard. Now, some people do, but the majority of people can't for a variety of reasons. However, with the activity suit, what's really nice about the suit for kids or adults, especially teenagers and the later they get into their high school years, the suit becomes a favorable option because when they put their suit on, now they can literally just go about their business and do all of their normal daily tasks while they're wearing their suit. And now, quite literally, everything they're doing with the suit on now also becomes a scoliosis exercise. And the benefit of that is immense. Now they're not setting aside a half hour or an hour a day to do some type of scoliosis specific therapy. It just becomes, I wear my suit and I go to tennis practice, or I put on my suit and I just do my chores around the house, or I put my suit on and I go walk our dog. I do my homework, I eat dinner, all of the normal things I do. And in fact, I used to think, and this is the way I used to teach it to other doctors too, is that you always had to be walking or constantly moving with the suit on. But I've found over time in reality that just isn't necessary. It's not true. That as long as you were doing a variety of normal daily things in your suit, the suit worked. Now, I don't want you to be sedentary. I don't want you to just put it on and plop down on the couch and watch TV with the suit on, because then obviously the suit's not going to work. However, the suit essentially works as kind of like a neuromuscular feedback device. So the more different variety of things that you do with it on, frankly, the better it works. Rather than somebody, and I'll give you an example. Somebody puts on the suit and they literally just walk on their treadmill for an hour. Well, now all it's doing is reprogramming the way you walk on a treadmill. I would rather have you put your suit on and cook dinner in it. Put your suit on and brush your teeth in it. Walk your dog in it. Do your homework in it. Go to baseball practice in it. Whatever it is, do all of those things day to day and maintain a variety of different daily activities that you do with the activity suit on. And it actually works a lot better because now you're giving your brain a different input and a different habit to build in the way that you do all of your normal daily different activities versus just always putting it on and walking on a treadmill, for example. So that's kind of one of the newer updates with the Activity Suit that I've taught for a few years now. Because we just noticed that people who do it that way tend to have better gains and improvements from it, or more consistent improvements, let's say, than people who always just put it on and walk. So food for thought. But anyway, now of course the suit can be used as part of a standalone, management plan, and meaning the physical treatment component of a management plan. I don't really honestly ever use the term standalone anymore with scoliosis management, because anything that's standalone is doomed to fail. Like, for example, I would never advocate anymore that somebody just buy an activity suit and do nothing else. Because again, if you're not doing anything else and you're not dealing with the core root of the reasons as to why the scoliosis is there in the first place, wearing a suit isn't going to make a long-term difference. It might make a short-term difference for a year or 2 or 3 or 4, but it's not going to make a long-term difference if you don't get rid of the reasons as to why that curve is there in the first place. So, so we naturally typically will pair the activity suit with some other type of exercise constructs, no matter what that looks like. Sometimes they're here doing a short-term therapy intensive or something like that. Maybe they're also wearing a hard brace, or maybe perhaps sleeping in a nighttime brace, especially if they're in high active growth periods of development. Say, for example, 11, 12-year-old girl who's on the brink of puberty, or maybe just started her first period. In some of those cases, it's not a bad idea to pair the activity suit with a nighttime brace while they're hitting their main rapid growth spurt, which is the main window of time at which a scoliosis curvature can get rapidly worse in a shorter time span. So it pairs well with a lot of things. Hard brace at nighttime, like I mentioned. Therapy, short term. Some people call them boot camps. Some people call them intensives, just depending on what system they practice. The other things that you could add in are going to be even all the way up through to post-surgery patients. And I know it sounds weird to say, okay, well, a fused patient, how is it going to impact their curve? Well, it doesn't necessarily always impact their curve. But there are a great many post-fusion patients that I see years after the surgery who are now having a lot of functional and pain issues as a natural consequence of the surgery. The benefit they get from wearing the suit is that they get a return to normal function, and they get a huge improvement in pain day to day because they're using the suit. Now, there are cases where we had, and I have one of the studies here that I'm going to highlight today, speaks to this. But in some of the older Harrington surgery patients that we've done over time, we've actually been able to restore some of the lost correction that the Harrington surgery was initially able to provide, but had been lost over the course of time. Now, you might ask, how can the correction from a surgery be lost? Well, I would tell you that the reason why it gets lost over time is because you never got rid of the reasons as to why the curve is there in the first place. So no matter what you do therapy-wise, even surgery, if you're not fixing the underlying reasons that curve started, of course it's not going to go away permanently if you don't get rid of those reasons, or at least mitigate those. So, and in fact, I'll just dive right into some of this data here. So we have, where did this go here? So this is a study published back in 2016. Radiographic pain and functional outcomes in an adult post-fusion patient using a scoliosis activity suit. Comparative results after 8 months. So this patient, and I'll give you the demographics here, but wore an activity suit for 8 months. So she comes in to see me, 59-year-old female, had been diagnosed with scoliosis as a 13-year-old. Ended up having Harrington rod surgery for her curve. She couldn't remember what her curve measurement initially was at the time that she had the surgery. However, what she did recall is that she had the Harrington rod surgery when she was 19 years old, and it corrected her curve down to 25 degrees. Her problem became that she had issues with the hardware. So she had a revision surgery a year later, and then a second surgery a year after that. And because the hardware had failed already. So rather than doing a fourth surgery, initial surgery and then 2 revisions, she opted during the third surgery to just take the hardware out. But that left her, of course, with a little bit of bony fusion because they do bone grafts and all that when they do the surgery. So she still had some bony fusion in place. Well, the 5 years after the final surgery she had, she started developing a lot of back pain, sciatica, and knee pain. When she came in to see me, and this was in 2015, she came in to see me in 2015, and the x-ray that we took at that time showed that she had a double curve of 56 degrees on the top and 84 degrees on the bottom. And in the study, I can have our producer put up the screen here and show you the x-rays that are in the study. And it's a pretty big curve, 84 degrees on the bottom, 56 degrees on the top. So we put her in an activity suit. And one of the things that we like to do is when somebody is fitted, especially an adult, well, frankly, anybody, but especially an adult for that matter, we want to make sure that the suit or that the person's spine has enough flexibility that the suit has a chance to work. So what I typically prefer to do is to x-ray them in the office after they've worn the suit for about 20 to 30 minutes, just to give their body enough time to acclimate to it. In this particular case, her 84 and 56 degree curves went down to 80 and 49. So at least we knew we were getting positive momentum. She takes the suit home, wears it an hour twice a day because we had to start her out slow. And then we had given her about a month later some easy basic activities to do, or I hate to call them exercises, but things to do around the house that I wanted her to do while she was wearing her suit. Then after a couple of months, increased it to 2 hours a day. And then we followed up with her about 6 months after she had gotten up to the 2 hours per day, or 2 hours twice per day, excuse me. So 4 hours a day total. So she came back 6 months later, or 8 months from the beginning. And on that film, 8 months later, now bear in mind, before that film was taken, we verify that the patient has not worn the suit at all or done anything for her scoliosis exercise-wise for the entire 24 hours before she comes. And that's an important thing to always make sure, because you'll see a lot of times practitioners will take films immediately after doing a therapy and sort of insinuating that that's correction, and it's not. It's a training effect. And it's even in PubMed that it's a training effect. And it's even in PubMed, you should wait at least 20 hours to eliminate training effect impacting the results of what an x-ray would show, or the curve measurements. So we wait at least 24 hours. Most people, to be honest, by the time they come in for that film, they're more like 30 to 32 hours, something like that. On that film, 8 months later, an 84 degree curve was 63. And a 56 degree curve was 38. And the x-rays are even in the study. So, and obviously that's a little bit bigger of a change than what I would have expected, especially in a post-fusion patient. So hence why I published it. The results are this is the International Journal of Clinical Medicine from 2016. So again, I'll put that up for people's reference. So it even works in people who have, a fusion surgery, who are post-fusion. And I have even other additional studies past that one on post-fusion patients to show that there is a difference between the outcomes of Harrington-based scoliosis surgery patients and the newer posterior spinal fusion pedicle screw kind of instrumentation, where the newer surgeries, they don't tend to get a whole lot of improvement with the suit, but they get a tremendous help in pain and function wearing the suit. So there is a little bit of a difference, and it's about making sure as a provider I communicate my goals with each and every patient accordingly so they're not being somehow misled. So, all right, so then that's in a post-fusion patient. One of the things I've also had, so again, I mentioned that I had the activity suit created and going back in 2007, 2008. Well, I've had a group of patients almost since I started using it in the clinic in late 2008, somewhere in that fashion. We've had a group of adult patients who have been wearing one since then. And then we've sort of been tracking their results accordingly. And so this particular paper, this is in the Open Journal of Therapy and Rehabilitation, and I'll have producer put that up. Pain and radiographic changes in adult scoliosis patients using a scoliosis activity suit, case-controlled 10-year follow-up results. So 10 years, these patients wearing an activity suit, okay? And these are all, so just to give you an idea, when we went back and looked at their curves at the beginning, when they started wearing the suit, for the entire group of patients, their average starting curve measurement was just under 44 degrees. So 43.9 degrees. When 10 years later, after wearing the suit, their average curve measurement at that time was 34 degrees. So about a 9-degree swing, which is excellent. Now, some people might say, well, 9 degrees over 10 years, so that's just under a degree a year. That's not that big a deal. Well, yes and no. First off, they're adult patients. And for those of you out there who've already gone through this, as an adult patient, you're told once you're an adult, there isn't anything you can do about it. You can't get it to improve by any amount. So first and foremost, this flies in the face of that. Secondly, the other thing you have to understand is their starting curve measurements were over 40 degrees, or at least over 30 degrees. And here's why that's significant. Under the known published natural history of scoliosis, if I'm an adult patient and I have a curve greater than 30 degrees or between 30 to 50 degrees, which were the majority of these patients, those curves, if I do nothing to prevent it, have essentially almost a 70% chance of increasing by a degree a year or a little bit higher. So if you extrapolate that out into here, their curves should have been 10 degrees or more worse, but yet they were 9 degrees better. So you have a total potential of a 19-degree swing over the course of 10 years. That's huge, right? And imagine somebody who went from a 43-degree curve to 10 years later having a 62-degree curve. I mean, imagine even what that does to you posturally, what that does to you physically to have that kind of an increase in that kind of span of time. So the fact that we were able to improve at 9 degrees is huge, and especially considering this cohort of patients at the later part, years 8, 9, 10, 7, 8, 9, 10, a lot of these patients were going through menopause. Well, menopause is one of those stages of life, or perimenopause more specifically, where you get a lot of rapid hormone change, and that period of life is typically associated with a more rapid increase in curve. So not only did we mitigate the effects of perimenopause, but we were still able to show a pretty significant correction in curves that are by default bordering the severe category. You know, if you consider 45 to 50 degrees as kind of that minimum threshold being called a severe curve. So I think this is a very, very important study that's been done, because one of the drawbacks we have in really all things non-surgery scoliosis treatment wise is we don't have a lot of window into long-term follow-up. You have a lot of studies that will show from start of care to a child done growing, or in adult patients, maybe they publish the results maybe a year later or 2 years later on the very high end, but you're not getting 10-year follow-up. I mean, my goal is to take the same group of people and follow them up for 20 years, which we'll be coming up on here in a few years. So my hope is that I can keep following up with that cohort and then publish their 20-year results. Eventually, if I'm in practice that long, maybe I get their 30-year results, depending on how good I'm functioning in another 20 years, another 18 years. So to me, that's the biggest missing link in non-surgical scoliosis therapies, and it's something we direly need collectively. And I'm not picking on any one method because we're all deficient in that regard, but we all need to do our part to try to get that long-term data out there, because the long-term is really what matters, right? I mean, it's great to help somebody for a year or two, especially help them get out of their rut, get out of their pain, get them back to life and function and so on. But you want them to stay that way, right? So the whole purpose of managing somebody in a comprehensive mindset is not to just help them for the next year or two, but to help ensure that whatever you did for them in that year or two is not going to just last a year or two, but now is going to continue to provide them that benefit for not a year or two, but for 10 or 20 or 30 years. So, but I digress. Now I want to switch gears a little bit here. Adolescent study. So again, for those of you who are familiar with my practice, we do a lot of intensive therapies. But I wanted to see, okay, if we could get kids early into diagnosis, meaning curves that are at a threshold where maybe naturally a doctor wouldn't do anything about it. What is the chance that we can help those curves, or how would the activity suit and having them wear an activity suit impact how their curve evolved over the course of their growth? Okay. So we had a group of kids, and these are all kids now for sake of research purposes and keeping the variables limited. We limited the group to all kids who had single right thoracic curves, just for comparative reasons, right? And from start to finish, so we followed the kids up when they were first diagnosed, or the time we first started seeing them. They were early in treatment. So they were all candidates, riser 0 to 1, early in growth. If their curves were significant enough, would have already been candidates for bracing. But their curves, for the group of kids, the average starting group was 20 degrees. Give or take 2 degrees. So 20 degrees plus or minus 2. We then broke that group in half. Well, to be more specific, we took kids who came in and had just followed our recommendations, wore a suit. We tracked them for about 4 years. We had another group of kids who started out with essentially a similar 20-degree starting curve. And just to give you reference, most conventional orthopedic surgeons don't typically initiate treatment until a curve is 25 to 30 degrees. And that's the SOSORT criteria. Now, some doctors might send for PT, but not everybody here in the States. Most orthos do not recommend exercise-based treatment for scoliosis or scoliosis-specific PT. They might typically recommend generic PT or something like that, but most don't send for exercise-based things if it's under 25 degrees. So both groups, or in the second group, which we call the control group, are kids who they got evaluated, found out their curve was 20 degrees approximately, but didn't do anything because the orthopedic surgeon was just in an observation, kind of watch and wait mode. And so the family went along with that. So what we did is we were able to collect a group of kids who were just observed and compared them to a group of our kids who actively wore an activity suit for about 4 years until basically they were done growing. Well, what happened was in the kids who wore the activity suit, 4 years later, their curves basically stayed the same. They started at 20 degrees plus or minus 2, and they ended at 20 degrees plus or minus 5. Very, very good, meaning we kept the curve stable just by wearing an activity suit and doing literally nothing else, because this is, it was a research kind of a thing. The control group went from 20 degrees up to 27 plus or minus 4 degrees. So again, very powerful, and a very, very low p-value, less than 0.00, actually was 0.006, so a very low p-value. So over that course of time, the kids who did nothing progressed to a point where now they would need bracing or would need some type of active therapy, whereas the kids who wore the activity suit, kept them at that 20-degree threshold to where now they're under that 30-degree threshold as adults, where now you incorporate or you introduce that risk of increasing by a degree or more per year across the lifespan. And of course, we want to avoid that. So the activity suit is very important for that particular reason. So just to recap, the Scoliosis Activity Suit, I created back in about 2008. We've had a lot of data published over time. It's used by a whole variety of practitioners, chiropractors, PTs, orthotists. It's used a lot in the Back Genius network. So you'll have doctors who use an activity suit with boot camp, like some of the ScoliSmart docs still do. You'll have people that use the activity suit in concert, like with a spine core brace or with a rigid brace. We have PTs, like I mentioned, that use the activity suit. So there are a variety of practitioners using this. In fact, I even have a neurosurgeon that routinely refers for an activity suit. A neurosurgeon, mind you, who routinely uses or refers for an activity suit for his patients. So again, the results sort of speak for themselves. If you go online, you'll find all kinds of references to the activity suit, but this is the home of the activity suit. So for those of you interested in the activity suit or interested in seeing if you're a candidate, I do free phone consultations all the time. And you're not limited by geography. We do all kinds of virtual suit fittings. We do them easily, and we do them all the time by Zoom. So if you're somebody who has difficulty traveling or can't get here easily to Michigan, we can always do it via a telemedicine approach. So if you're interested, you can reach out to me directly. And I'll put the clinic website at the bottom of the screen. I'll also give you my email. And that's mmorningstar@backgenius.com. Our local office email is info@nwprc.com. Either way, you can get a hold of me that way, and we can set up a free consultation to see if an activity suit is right for you. Bear in mind, as I already mentioned on the show today, the activity suit is rarely something I do by itself, because I think if you're going to be somebody who wants to invest the time, money, and energy into wearing an activity suit, my goal is to give it the best chance to work long term. So there are going to be inevitably things that we pair with it to give it the best chance to work over the long term, not just the next 6 to 12 months. So if you're interested, obviously you know how to reach me. I'm Dr. Mark Morningstar. Thank you for tuning in for another week of the Scoliosis World podcast. I sincerely appreciate it. If you like what you're hearing, please subscribe to the channel. I would very much appreciate it. We are now at, I think, over 3,000 subscribers, and we keep growing. So kudos to you. I appreciate it very much. And we will talk to you next week. Take care.